Hey, this is Dr. Ty from Premier Orthodontics. In this video, we're going to be answering questions we got on our YouTube channel. So if you haven't yet, make sure to subscribe to the channel, tap the notification bell, and like the video if you find it helpful. So let's jump in here and get started. So this question's from Michael Wilson. Approximately how long does it take to recover and return to work from the jaw surgery for an underbite? So jaw surgery is not a small surgery. Generally, you'll have the surgery and then you'll oftentimes need to stay in the hospital for at least a couple days. And I would give yourself at least a solid week to recover fully before you're returning to work. You know, those first couple days will be rough. You'll be really swollen. You'll be bruised. There are times that you might need to have like a splint in place with rubber bands, and you probably are not going to want to be going out or going to work in that case. So definitely a week is probably minimum. But I would ask the oral surgeon that's going to be performing the surgery on you specifically if there's any recommendations. So there are different types of jaw surgeries depending on if it's upper and lower or both, or how many pieces they have to do with the surgery of your jaw. So obviously there's going to be different surgeries, different recovery times, and your oral surgeon will be able to recommend a good recovery time for you specifically. But again, I would plan on at least a week, if not more, because this is a major surgery, and unless you work from home doing things that you can kind of sit and rest, you may not be wanting to go out much just because of the swelling and bruising that you may experience. All right, this question is from Ocean of Foxes. Are there any contraindications to use a permanent metal wire retainer after Invisalign? I've come a long way wearing braces almost all my life, being born with an underbite plus cleft palate, went through some surgeries. I didn't wear my retainer last time because I have a sort of PSD after all those procedures. I want to fix minor problems that I caused with my laziness with Invisalign, but I wouldn't want to wear a retainer aligner every day. I just want it all over. Also, do you make bonding in your clinic? Do you recommend this? My dentist says I have quite light and good quality teeth, but their shape is odd. She doesn't recommend veneers so I don't ruin the teeth, but she also says bonding isn't pretty and hard to maintain. Maybe there are other methods to make a perfect smile. So, all right, we got quite a few questions in here, so we'll go ahead and get them one by one. So, are there any contraindications to use of a permanent metal wire retainer after Invisalign? So generally speaking, you can do permanent retainers after braces or Invisalign, but permanent retainers only maintain those front 4 or 6 teeth. So if you did a lot of correction on the back teeth with the bite, then a permanent retainer is probably not going to be the best option. You need to have some type of retainer that maintains all of the teeth. So usually we'll do a permanent retainer in combination with a removable retainer if we feel like there's something going on with the front teeth, like they start with a lot of spacing or rotations, and we feel like we need something in addition to the removable retainer. A removable retainer is definitely the best option for maintaining any sort of major tooth or bite correction. So it sounds like you had quite a bit of treatment between the cleft palate surgeries, underbites, everything like that. So I definitely understand that. I treated a lot of cleft palate cases when I was in residency, and there are obviously it's half your life is spent in some type of surgery or orthodontic treatment, and it's not easy. So I can appreciate kind of the issues or problems that you went through. As far as the best way to retain your correction, it's still going to be a retainer, and you do need to wear it for basically the rest of your life if you want to maintain the correction of your teeth. So I would try a different type of retainer. Something like an Invisalign tray, a clear plastic retainer is a good option. And usually, eventually, you can start wearing these only a couple nights a week in order to maintain the correction. Usually right when you finish your treatment, it's going to need to be every night of wearing your retainer. Over time, you can taper that off. So currently, I wear my retainer about 2 nights a week. That's enough. You kind of know after a while that if your teeth are starting to shift or move, the retainer feels tight. That helps you judge how long or how often you need to wear the retainer. So next, you asked about bonding in your clinic due to the teeth shape or size. So we will sometimes do that, but your dentist is right in that tooth bonding is temporary. It looks good when we first do it. Over time, it does tend to discolor. So a veneer or a crown is a better long-term option. And I know you're concerned about damaging of the teeth. Generally, veneers are needed in order to do a veneer, they have to remove some amount of the enamel on the front of the teeth. There are different types of options now where they can do a veneer without having to remove enamel. So I would ask a cosmetic dentist. I'm an orthodontist. I'm not an expert on these options. That's not something I do. but there are a lot of options now available where you can do veneers without having to remove much tooth surface. That's usually the best long-term plan if you want to have something permanent that you don't have to maintain, over and over. A buildup or a composite veneer, something where we use a dental filling material. Those work great, but usually every couple of years they will need to be replaced because they will tend to chip or discolor, but they are a good temporary option if you're waiting to do that final option with the veneers. So kind of just to summarize, permanent retainers are good to maintain the front 4 to 6 teeth, but a removable retainer worn at nighttime, at least a couple nights a week for the rest of your life, is going to be necessary if you want your teeth to stay perfect, which is what I always recommend for my patients. And if you're looking at cosmetic dental work, I would definitely ask a cosmetic dentist. Again, orthodontists, we learned about it in school. We might have done it a long time ago. Cosmetic dentists do this every day. They're the experts. They'll be able to advise you on the best options regarding buildups, composite bonding, or veneers, and what options are available. Hopefully that helps. All right, so this next comment says, so what if you're missing molars? How would you correct that with a deep bite? Anytime that we're missing molars, it does make deep bite correction a little more difficult. So it really depends on how many teeth remain. Generally speaking, a deep bite, to correct it, we want to intrude the front teeth and extrude the back teeth. That helps to prop the bite open. So if we don't have any back teeth to work with, it does make it more difficult to get that effect. So this is really going to depend on if you're missing molars on top and bottom, or just one arch, or just 1 or 2 molars. There are options available. So again, I can't specifically speak to your situation, but it is possible, but it does make it a little bit more difficult, and you may need some sort of extra appliance, such as like an orthodontic mini screw, to help with some of the intrusion if we don't have the molars to use as anchorage. So as far as how to fix missing molars, generally speaking, orthodontics isn't a good way to replace missing teeth. That's more through restorative dentistry, through a bridge or implant or a partial denture. There are lots of options available. Orthodontics might be helpful to do prior to that restoration to help get the teeth set up in the proper position. So hopefully that's helpful. Deep bites can be corrected if you're missing molars. It's difficult to do, but it is possible. There are just some different ways we need to approach it, and hopefully that helps. All right, so that is it for the video. If you found it helpful, give the video a like, subscribe if you haven't yet, tap the notification bell. If you have any questions, ask them in the comment section below. We may feature them in a future video. And thank you so much for watching. We'll talk to you soon.